South Africa's overcrowded towns and slums suffer the most from the status of having the world's highest infection rate for tuberculosis and HIV. That means millions of poor South Africans have compromised immune systems. Health experts say the added threat from coronavirus could bring the already stretched healthcare system to its knees.
If it's a community outbreak with only a few people affected and we can contain the virus, it would be fine. We would be able to manage. If it is unfortunately an outbreak, let's say in one of the informal settlements, the risk of people there getting seriously ill would be worse. And those are the people also that we would be that we are afraid of will have to be hospitalized. And I don't think the system will be able to treat a huge influx of people seriously ill.
South Africa's pharmacists are on the front line dispensing medication and trying to educate on coronavirus prevention.
I think in the general communities where there's large populations, I don't know how they would be able to handle it, but I think they have made provision in the larger hospitals, in the main centres. I think they have made provision.
But South Africa's epidemiologists worry about the crowded slums where social distancing is almost impossible.
How can the sick person try as much as possible to keep themselves separate from other people? For example, even if you're sharing a room, to stay 1 meter from people, because 1 meter is the critical distance over which the droplets of the virus can spread.
For this pandemic, South African authorities are hoping for the best case scenario, that the country's lockdown can bring it under control. Meanwhile, South Africa hospitals are preparing for the worst. Franco Puglisi for VOA News, Johannesburg.